Cool. Well, hey everyone, my name is Kels, as you guys know. Let's see, I like milkshakes and long walks on the beach. I'm kidding. I do love a good milkshake, but let's see, I've been in clinical research since about 2010. It started when I was back in high school and all through my college career as well. Once I graduated, though, I went into emergency medicine, specifically in pediatrics, and then transitioned back pediatric research in diabetes and endocrinology. And then from there, I decided tiny humans had enough of me and I transitioned to adult oncology. I did that since 2016. And in the last 3 years of that, before I transitioned to my educator role, I was in phase 1 clinical research. So I've done everything from pre development all the way through phase 4 and bringing medications to market. Now, Tiffany.
Wow, that's a beautiful way to share your energy and talents with the world. So yeah, I'm Tiffany. I don't know. There's like, where do you start? So I'm here because I'm a Reiki master teacher. I have a Reiki school here in Richmond, Virginia. I do in person and online classes, and I also have a master's in social work. So I actually started my career in hospice. And then I spent a lot of time in foster care and then through administration. And then finally just found that I had to work at a different level. So hello, woo-woo, hello, energy work. Here we are. And I've been doing that for, I guess, 22 years now. And I've, I don't know, like, what road do we want to go down with this conversation? I have the BRCA gene. So I had my breasts removed and my uterus and my ovaries removed. And I felt, really clear about that choice, but still like living with that and the process of healing from that has been a big part of my journey. And I think the Reiki, the energy work, even whether it's Reiki or not, like tapping into an ethereal plane of your existence, like that helped me recognize that I had something shaken on a cellular level. And so I got to that way.
It's okay. I'm going to jump in because I actually got a question from someone that messaged me very specific to that. So since we're discussing, like dealing with the emotions that come with this journey, right? Everyone on the call. So the question that I got was, how do you handle the emotions associated with knowing that you could have a diagnosis, but haven't yet? And this person then goes on to explain that they also came back as PSA heavy. So this is a patient that has prostate cancer in their family, and they're being told of all the different things that they can do, and they're struggling with that. So how was that for you when you got the news of that BRCA positive for you?
Okay,
And one more thing, for those of you on the call, the BRCA mutation of the BRCA1 gene or 2 gene, these are oncogenes. So these are something that we can track. We can either do them at a biopsy of a suspected lesion or bump that you find. We can also do this through your blood. There are certain companies like Foundation, for example, that will actually screen for these things. They are expensive, so you do have to have a background or some sort of family history in order for this to be covered by your insurance in the United States. Otherwise, this is available to anyone that speaks to their primary care physician. Go for it.
Right. So in one word, let's start with mindset. I think like it's easy to spiral. And so, and I certainly did when I got the news, I had kind of forgotten that the feedback was coming that day. So I went into the meeting, it was a virtual meeting, and was like, oh, life changing. Here's a before and after moment. And here we are. But I really think moving feelings through like that, that's where I got where I'm feeling like energy work really has a positive role in this. Even movements like Qigong, which are like all over the internet, or lymphatic drain, like when you're moving, um, you energy gets stuck. And so I think diseases come, that's the philosophy of Qigong, which I'm no master of, but in that thought process, the feelings begin to layer in the muscles and the tissues, and then that can develop. So, how do you get through that moment? God, okay. Well, one practice I love is intentional gratitude. I'm actually have another a 21-day series of this coming up. It's called Elevating You, but I do it. I walk people through it in 21 days. But you can find it. There's a book called The Magic by Rhonda Byrne. That is like the sister companion book to The Secret. But it's saying like, if you don't tell your mind what to think, your mind is going to go to autopilot. And in cases such as life changing diagnosis, and that we're hearing about catastrophic possibilities, if we don't dictate to our mind what to think, then we are going to go down that road. So not that this will change the outcome, but deciding what you're going to think about it, reframe. My favorite thing is, and I have a friend, Ashley Covington, who really introduced me to intentional gratitude. And the easiest one is thank you, thank you, thank you. With every footstep, Einstein said thank you 100 times a day. So it's been said, because that elevates your frequency, like your existence. So when you hear about miraculous outcomes and how did that person survive that, or you beat the odds situation, those moments have to do with mindset. Those moments have to do with what am I telling myself? What am I telling my body? So much so that when I found out, I got a picture of myself, age progressed to an old woman. I looked at it every day, and I realized that getting the wrinkles and the sags was not like the downfall of my life. It was the gift. So I look still at this picture of myself, age progressed to like 80, whatever. And I'm like, time is the gift. And I'm telling myself, I'm telling every part of my being, you're going to be an old lady. And I think it matters. I've seen it matter.
I was going to say it. That's actually something, a lot of people have doubts when it comes to the holistic approach and the osteopathic approach to medicine. And does it actually work? And I've always said, if it doesn't hurt you, always discuss it with your medical team. If it doesn't hurt you, I'm so for it. If it brings you comfort. And I want to, did I create an echo? Was that me? Oh God, it probably was me. I'm sorry, guys. But we'll see, for example, patients that have some sort of already a mental issue that they do deal with. So, for example, my brother, shout out to the genetics of my family, suffers from massive depressive disorder. He just has depression. It is a higher degree, let's call it. So, emotions are very hard for him to overcome. And those are also, we see this correlation with having gastric issues. And so, if my brother has something very stressful going on, it manifests itself in his stomach. He's more prone to ulcers. He's more prone to gastric reflux. He's more prone to GERD. And so, you suddenly see these patterns with patients, and you're like, this chronic inflammation that you're dealing with is all in your stomach. And you'll hear people say that. They're like, oh, anytime I get stressed, I get a massive migraine. Well, it's not that your trigger is the migraine, it's that you carry your inflammation in your head. So I appreciate that you brought that up because again, some people they were like, "Oh my god, if I say this to my doctor, they're gonna think I'm freaking crazy," and it's not like that at all. There's everything is so interconnected. Um, and I did want to also bring up because you brought in the mindset part. What was your and this is something this is actually the same person from that first question. How did you articulate everything that you were feeling to your family so that they didn't panic along with you, or did they panic because you had more control than they did?
Um, I think,
Oh, you have
yeah,
really?
yeah. Well, I have a 6-year-old daughter and a 12-year-old son who were, what, 3 and 9 at the time.
Yeah.
So I didn't have questions of how to respond. I kind of, okay, well, it wasn't a complete shock. So how did I, um, okay, Can you please repeat the question? I got in my head.
Absolutely. No, you're fine. So the person's backup question after like how do you deal with the news is how do you deal with articulating that news to what will be your support system or just the people like you're saying like there's children so not necessarily a support system there but how did you say it to tiny humans and how did you articulate it to like your partner, your coworkers? How did that go about?
Yeah. Okay, great. So that's where I was going with this. I do this thing where I default to shock value. Like I'm totally ADHD and that's just kind of my like quirk or my neuro difference, if you will. And it was cute when I was younger. It's so like weird now that I'm the space I am in life, but still it's just my natural go-to. So I just kind of like my children, I was mindful about it, obviously. My husband, we just straight talked about it. I remember talking with my family, but what I was going to mention earlier, where I got sidetracked, was that in my paternal lineage, women died young. I have seen this. This is probably part of the catalyst or what catapulted me into ethereal like ways of being, right? Because I've always pondered death. I've seen like the women in my family die at like 40 on my dad's side. On my mom's side, 85 to 100. So longevity on that side. But on this side, and it always just kind of resonated like something's wrong, something's wrong. There's always a nagging. So while it was a complete and utter surprise, it was also not a surprise. You know what I mean? Like my anxiety level, my baseline used to be like this, which is why I went from, at one point in my career, I had 20 employees. I was the director of an agency. And I still just had to come back to like soul work because my insides would be so nervous. And so once I heard that I had this thing, the catastrophe was over. The shoe dropped. It was like a smooth river. So it became easy. And I'm just an authentic person. I think with my children, and so I say too much, I might repeat or just make it. I probably made a joke about it. But with my kids, like, with my daughter specifically, because she's like, Mommy, am I going to have boobies? Because I decided to stay flat and not get implants. And love that choice still. So my daughter's like, am I going to have boobies? And like trying to discuss with my children, like, yes. And I haven't actually at this point discussed with them. I'm going to wait till they're a little older to discuss the genetic portion because
Yeah,
it can flip and they can't even get tested till like 21 is my understanding. So this is not a conversation for now. But
sure.
when the conversation for now was, hey, I'm going to be laid up and like cut up like Frankenstein, um, I just went for it, you know? And I think
Absolutely.
if you're not the kind of person that can just like, hey, and trust me, it's not always the right
So it's
way.
an acquired skill as well.
Right. I'm not saying that's great, but it is my default. Make a list, like and just kind of, you know what? Before you do that, here's what I'm thinking is when we're thinking about mindset, it's like decide how you feel about it first. Like where do you stand on this? What are your fears? Um what are your hopes? Where do you see yourself in 3 to 5 years? Like where do you stand with your own mortality and the news you've gotten? Go there first.
I
And
agree.
then go outside and tell the people that matter.
Yeah, and I was going to um double end this. So first things first, somebody just messaged me. So if you see me looking over to the side, because I have my phone propped up, and so somebody's asking, "How do you know if you have family history if you are adopted?" And so, someone who is adopted, I always recommend you assume you have everything in your genetic pool. That is the safest way to go. You assume that you have everything. You are a genetic anomaly. If it exists, you have both every single cancer and the cure for cancer in your body all at once. And I do that because you have no way of accessing the information. So that's how you're most safe like that. Now, if you're not necessarily adopted, but maybe you did a 23andMe at Christmas and we suddenly found out that daddy had a secret or something like that. And maybe your two parents are not both biologically your parents. So you only have half of the picture. What you were explaining is really important. That half is already important. If you, I, I don't know if they all insert name of, let's say, like, I don't know if they all passed away from melanoma, but like you just said, every woman in the family dies by 40. That for me is alarm bells, right? Because there's
Yeah.
only so many things that will in such a pattern do that. Or hey, by the time I married your father, it was only him. His dad was gone, his uncles were gone, his brothers were gone. Okay, even if you don't know the why, even if you, oh yeah, Uncle Timmy was, he was like 42. Because again, it's not necessarily always that cancer is the answer. It could be cardiovascular, right? This could be, we just all have heart issues. And that's like for my dad. By the time I came into the picture, my dad's mom had passed away. He never knew his father. And his brother was not mentally in a situation where he could articulate anything. He was a Vietnam veteran and he was shell shock and all of the things combined. So, my dad was just like, I know we have bad hearts. That's what we say. That's all a very Latin thing that, you don't say you have diabetes, you say you have sugar in the blood. And so that's all he could ever give me for family history. He's like, I know we've got bad hearts. I just don't know what that means. And, you know, medicine being what it is, well, what do we know now? Well, with my brother, he has high cholesterol. He has, like I mentioned before, he has gastric issues. So I have some of a picture, but any of that information that you can come to is information for your medical team. So don't ever think this is like, oh, I don't know anything. No, you might know something. And all of that can be used for your full medical picture. Now, the other thing I wanted to mention, because this other question came through, was at what it's a really funny question. At what point do you decide it's too much even for yourself? And I wanted to just pop in for this one because I had a health scare. I found a lump in my left breast. So my background in why I would even at 33 years old be performing a self breast exam was because I have polycystic ovarian syndrome, which means my hormones are they do whatever they want, however they want. There was a point upon diagnosis when I was 11, metabolically speaking, when they took my blood, I looked like a boy. The nurse came in with my blood work, looked at it, looked at me, walked out, walked back in and said, I'm so sorry. Your testosterone's so high. I thought this was like a boy's blood work that I had grabbed. I'm so sorry. And so my poor doctor's sitting there. She's like, you're probably our first PCOS patient that's this young. And lo and behold, if you find the original research, it's me. And I was 11. So I was one of the first to be diagnosed with that. But with that mentality, it makes me more prone as well of developing some sort of breast cancer. Why? There's several forms of breast cancer that are fueled by hormones. They eat, that's the food. Um, and so that also guides this conversation, right? So when do you decide that it's too much? I like what you said, Tiffany. It's too much when you say it's too much, right? This is your journey. I will never, and I tell my patients all the time, like, how do I tell my wife? I say, you tell your wife when you're ready. That's the answer here, when you are ready. Maybe you don't want that kind of support, and that's okay too. Some people are just like, how could you not tell your family? Well, how could you tell your family, right? It goes both ways. And I'm not the biggest fan of the guilt that comes with that. Um, Even if you were like the biggest smoker and the heaviest drinker and the most like careless when it came to your son, it doesn't matter, right? No one does anything in their life hoping that it causes something like a cancer to develop. It's not your fault. And I think part of the guilt that comes from how do I tell my family is, did I do this to me? And I tell patients all the time, just because when you walk through that door that says, cancer center at the top of the building, life got you here. It wasn't anything that you specifically did. And, so of course, there's going to be people that are just like, absolutely it was. No, because I lived in Florida. Like I didn't ask to live in Florida. That's where I was raised. And that automatically makes me more prone to having a skin cancer. My mom right now is right here on her forehead. If you ever see her, she has a scar. She had a BCC, little basal cell carcinoma. Otherwise benign, but still a cancer, and it's got to get cut out because they can get big and aggressive and just, cover your whole face. But it wasn't that she like wanted that. She's a child of the 70s, you guys. Like it was lounge out at the beach all day, and then it just came out later on in life. You didn't earn this, but it is a part of you. So you get to dictate how your journey goes, who's involved in your journey. how they're involved in your journey, right? Like maybe you're the kind of person listen, I just need someone to rub my shoulders when I get home. I don't need someone sitting there next to me for a 4 hour infusion. Depends on who you are. So that's how I will answer that. That this is very much everything has to do with you. I even tell patients like you're coming to me because you want treatment. But the day that you're done, you just come to me and you say, this is the last time we're seeing each other, and we'll hug and we'll kiss and we'll dance, and then you don't have to ever see me again.
Yeah.
So I'll see you at the supermarket, So it very much, and I think that's a really big responsibility that people feel. It's like, is it really all on me? Yeah, it's all on you. But that's a good thing, right? Because the same way I always say a good physician will put all of your choices in front of you. They'll never say like, hey, this right here, that's the choice you have. They'll never do that. They'll say, we can do this, we can do this, we can do this. We can also do half of this and some of that. And they put it in your hands. Don't feel like that's because the doctor doesn't want to be responsible for the decision, because you could also put it back in their lap and be like, whatever you say. You could totally do that. But for the most part, we guide ourselves through our treatment journeys the same way that we do on the clinical side. What do you want your life to look like? What does your bucket list look like? I've had patients just say like, listen, I just got to get to September. My daughter's getting married and she wants me to walk her down the aisle. Okay, well, it's March. Your prognosis is pretty decent. I can do September. Anything you got bigger plans? And they're like, no, let's get to September 1st. Okay. You also tell me, no, in 3 years, I booked an Alaskan cruise. I'm gonna see a humpback whale. Okay, my job is to, you know what I mean? Like my job is to get you to that humpback whale. And you need to put your trust in us to be like, hey, your treatments aren't going great. Can we move the 3 years? Can we make it like 8 months? Can we get to the cruise faster? Or hey, there's a I don't know, blizzard coming. You're doing great on your treatments. Feel free to push that out. Why don't we let's make a 5 year plan? It goes both ways. We'll never, I don't want to say never, but I do want to say always remember that your care team is on your side. They should not be dictating this for you. Um, that was also me talking very, very long, and I do apologize. The next question.
Wait, it
And
felt so.
yes, oh my God, please. Yeah. And that actually leads into the next question perfectly. It's like we planned this, but like we didn't. It's a I was gonna say like we planned a meeting, but we didn't plan the dialogue because this is hilarious. So you were just saying like bring as many members as possible, and this is actually an integration of care questions. So it's two parts. For me, it's at what point is too many people, too many cooks in the kitchen? And for you, Tiffany, the question is when did you realize you wanted to bring in something like crystal therapy or Reiki into your care? Would you like to start your part first, and then I'll follow up?
Sure. I actually brought Reiki and holistic healing practices when I was struggling with infertility, which I didn't come to find out later was all kind of interrelated, because when they pulled my ovaries out, one was really little and one was normal. And um, so, there was foreshadowing or a sign, I guess, of the BRCA gene that looking back, I put the puzzle together. So, um, So yeah, that's when with infertility that, and then it just kind of stuck around because I realized
It was
my
home.
life was better. Like for
Yeah.
me, Reiki energy healing is not something I do, it's who I am. It's a way of being. And so it's the mindset of gratitude, it's the mindset of pushing things through, big or small, and it's the mindset of believing in freaking miracles and
So true.
expecting them. um so yeah, it started at one of my lowest points, really, is where it started. Yeah.
And I was going to say that's actually exactly what I was going to say in terms of when do you know when to bring somebody else in? When you feel like you have to, like you suddenly feel like, I feel like I'm drowning. I feel like I'm out of options. I feel like no one's hearing me. It might be time to revamp your team. I'm
Yeah.
actually going to go into a little bit of what Carissa mentioned with Tumor Board. So, Tumor Board is essentially, I can explain how it was at the Winter Cancer Institute.
Wonderful.
It
Thank you.
was, yeah, it was on Mondays and it was after clinic. So, it was usually at around the 4:30, 5 o'clock mark. Sometimes all the doctors would be there on time. Most of the time, surgeries run late, clinic runs late, emergencies happen. So we start with whoever we can. And a friendly reminder that I was in the genitourinary, so everything that has to do with creating urine and getting rid of it. So everything from penises and bladders and prostates all the way to the kidneys, the adrenal glands, and all of those guys. So all of the care providers associated with that care. So I'm having conversations with surgical oncologists, radiation oncologists, medical oncologists. So surgical oncologists, they cut out the cancers. Medical oncologists medically with medicine treat these cancers. Radiation oncologists with radiation or and not always external beam. So we think of EBRT as like you go in and they go and they zap it and then you go home. That's not always the only type. There's also like proton therapy and things like that. But now I'm also bringing in cell therapists, right? Which is an almost exclusively research mindset, right? These are people that are going to gene edit something about you. They're going to pull out white blood cells and re-engineer them. They're going to manipulate something about you in a non-nuclear medicine way. We bring in nuclear medicine because yeah, we have some radioactive isotopes that I can like stick in an IV and give you as well. But I also have endocrinologists, right? If I'm dealing with an adrenal cancer, your adrenal glands produce cortisol. I can't just cut them out of you and be like, okay, the cancer's gone because there went your one producer of a life sustaining hormone. If you don't have cortisol, you will pass away very quickly. So, and of course, you can have them removed. And we have things like Addison's disease, which is your adrenal glands just naturally stopping for one reason or another. And so I can give it to you, but it is life threatening and it is an ER visit. If that happens to you, you gotta say hi to me and all the nurses and doctors that I work with. So
I'm gonna
all of
say
these
real quick
things, they're
also,
starting.
like,
Yes.
just from experience as a cancer survivor and some other cancer survivors that may be in here, um, we end up with forms of diabetes, hypoglycemia that are now like not the typical type 1, type 2 because of either like A, because I've had my stomach removed, so it affects my digestive system, or B, you had chemo as a child. And now it has damaged. So you can see lifelong things that are not even necessarily based on like you had that type of cancer. A lot of cancer
Exactly.
patients end up with endocrinologists. Anyway, thank you, Kels. Go ahead.
Yeah, and that actually leads to the next thing. Some of my treatments can cause these things, and that's why they're there. You're gonna have the endocrinologist kind of quietly in the corner be like, "You're gonna kill their pancreas with that one. Please don't do that." Or my personal favorite is when we bring in the ocular doctor. So all of our ophthalmologists, our retinal specialists, and they're just like, yeah, you could do that if you want them to go blind. And that's literally how the conversation goes because these are all no one is doctor whatever. It's all first name basis. Us research minions are in the corner like, wow, because everyone's so smart in this room. But that's literally what it is. And we bring in social work to tell us, hey, is this even financially feasible? Is insurance going to let us do this? I'm trying to think of what else we've brought in. Oh, we've brought in chaplains.
Yeah.
Hey, do you think the patient can their caregiver system can they sustain this news? Like we're talking about doing something for the first time, right? If you watch Grey's Anatomy, this happens all the time. You're the first patient we've ever done this operation on. Hey, somebody was the first patient to receive HIPEC, which for those of you that don't know, it's a very common but also a very difficult procedure for patients that have gastric cancers. It's very aggressive. It is I don't want to call it a Hail Mary because it's not, but it is never going to be our first choice to do HIPEC. right? This is a very specific procedure. And we're kind of looking at a patient and we're just like, if I really want to get this under control, I need to do something really as aggressive as the cancer. And again, this is why I need a table that goes from here to all the way behind me with every specialist you can imagine to make sure, can the patient go through this? But then I also need the human side. I need my social workers, my chaplains, my Reiki experts. We bring in sometimes the men and women that handle the therapy dogs. Be like, hey, who are your dogs like attracted to the most? Like, who are you seeing them constantly circling back and being like, hey, like that person needs cuddles and why? And that's all the stuff is stuff that we study to see like, okay, Winship actually went from not having the therapy dogs as a thing. It was super popular at the Children's Hospital. They had the golden retrievers, the sheepdog, the Irish setter. They have them all. And now Winship Cancer Institute does have the therapy dogs, and
Wonderful.
that comes from right. Like this comes from these conversations where at first you thought this wasn't necessary, and suddenly you're just like, hey, we don't know how. Maybe it's because we believe in the miracle so much, but after we got puppies, people are having less reactions in the infusion center. I'll take it. I'll take it. I don't care if it was or wasn't the dogs, but it happened after the dogs. We keep the dogs. We even have a cat.
That's gonna follow into, yes, mental health and integrative medicine, and also coming up soon we are also going to be talking about medical alert and service dogs. So
Exactly.
just a quick
And the
topics
fun,
to come.
yeah, go ahead.
That's it.
Mhm.
Go ahead.
Oh, I think I was gonna say, I think you were breaking up.
Oh, I'm sorry.
I
I
see
was
you
just going to say
speaking.
those are
Oh yeah.
we will be discussing medical alert dogs and all of these things that you just, and also that one of the things that we at GLOW-Oncology are kind of working on is bringing a patient advocacy voice to the tumor board and saying, hey, maybe have a patient there who's already been through this that might be able to add some perspective as well.
Yeah, for sure. And somebody just messaged me saying, what exactly is Reiki? Tiffany, that is so you. I cannot answer that question.
You want to take that one, Cal?
No.
It's the channeling of universal life force energy. It follows the chakra system and the meridians in your body. But yeah, it's like we open the crown chakra, and if you become attuned to this energy, then you just kind of channel it as if you're a straw, and so a vessel. I like, to give you a visual.
Yeah, no, that's almost like when people say like, oh no, I need to like realign myself with nature, and they go on those like tech-free vacations so they can just like reset everything.
It's exactly like people do it all the time. It sounds, to give it this formalized way of being, it sounds so woo woo, but it's stuff people do every day. It's just next level. Like this is a skill or a tool, a skill that anyone can work with. This is an energy anyone can work with,
Yes.
but the more you use it, the stronger it becomes. So it's not a religious activity. It is a very spiritual activity. You can link it to multiple practices listed in the Bible, like the laying on the hands. You can link it to almost to many ancient religions and practices, but
Well,
it's
even Florence Nightingale, so the mother of modern nursing, she said, the healing touch is literally taught to this day. It's a whole chapter in nursing school is the healing touch. You have to be in physical contact with a patient. This is part of what made dealing with COVID so difficult was it wasn't just like gloves. It was so many barriers between me and my patient.
sure.
And that was part of it. I remember one of the nurses who actually passed away of COVID, but I remember him saying he was just like, I can't connect with my patient because I can't even hold them while they're crying. And I like you said, it's like they're all interconnected. We just don't put the word Reiki in front of it, but that's part of
Well,
it. It's like me touching someone and being able to connect with them.
And the more you strengthen and develop this skill, this ability, then this would have been a great time to have. I've wanted Reiki in hospitals, and some have them, some don't. It's very touchy, I guess. Not all hospitals are willing to have Reiki practitioners, But that would have been a prime time to have Reiki, because when I'm doing sessions on people, when someone who's practicing Reiki on themselves or others, you feel cold, you feel difference in the energy. And then you can say, I mean, I've, walked people through fertility issues, through lung cancer, through different things. When someone is with a cancer, there's a grayness in their aura. Through the Reiki practice, we learn to read auras. So that is a thing. Like, sometimes I can see that on people before they know, and then you hold the responsibility of, do I tell you, don't I tell you, and there's that whole ethical piece that's involved there. Like the cashier at Staples, that was not my place. But
I was like, how do I tell him I don't?
my friend's dog, I felt okay about saying, hey, take him to the vet. But it's a development of a skill that anyone can access. And it gives you, because our physical field is not where we end 6 inches out. And so within that 6-inch energetic field around us, there is so much to be told. So we hold, and in the practice or the philosophies of Reiki, if that energy, if we can cleanse it from the inside out, it's not getting stuck. So there's the ancestral, there's the emotional, there's the mental, and there's the physical. So by the time it gets to physical, that's when we're getting involved with the doctors and even the emotional, but there is the ancestral. And so modern medicine is there too. I mean, if it works, it could braid itself really nicely together, because
Absolutely.
there's intuitive nudges. There's so much to the energetic field that we can't necessarily see, but you can see it in images. You can see it. I had some of my students together, and we had a heart doctor come with his ultrasound machine, and he did ultrasounds of us. We were all Reiki masters. So he, he did the ultrasound on us, and he said, then we did Reiki on each other. And then he did the ultrasound again. And he said he had to cut the light down because it was so bright, like the readings he got. But even the baseline readings, because we were practitioners, were a different baseline than, and so that was cool. Like there's components of it that are extremely tangible.
And that was actually the next question that I have here. They're like, at what point do you not consider this witchcraft? And before we actually started this conversation, I was telling Tiffany, I'm like, I don't care if it is witchcraft. If it works, it works. But the important thing is to always have an open dialogue.
Yeah.
So one of the important things, especially from the research perspective, I need to know everything you're doing. And this is not because there's some secret pharma plan to make sure that everyone dies when they like that. I refuse to believe that. I think there are way too many wholesome people that are truly dedicated to figuring this out, that are so supremely intelligent that it really just is just such a difficult problem. It's not that there's some higher secret in a vault somewhere that the cure is there. It's also because, you can have two patients. I will take you to clinic. I will show you. I will have two patients, the same age, same diagnosis type, same tumor type, and the treatment works on this one and not that one. And I can't explain why. All I can do is keep treating this one with treatment A and then move treatment B to this other patient. And so with that in mind, why do I need to know what you're doing? Some of the things that you can do have secondary effects, like you just mentioned. If I don't know that a patient's doing Reiki and then I send them to do an ultrasound because maybe it's hard for them to urinate, and we use an ultrasound to look at the tubing of your kidneys. Maybe you need a stent, right? Maybe it got a little too narrow in there. Well, if I don't know you're practicing Reiki and I don't put that in the notes so that the ultrasound tech knows, like, hey, your readings might be off, be careful. Imagine now I'm going to get back an ultrasound that you paid for. You paid your deductible, you sat and you waited, you scheduled it, you did all these things, and then it doesn't look right. Why am I saying that? My favorite phone call to get from radiology is when I have a successful treatment and they call me and they're like, hey, I'm looking at this. You have the ICD-10, like the diagnosis code. You have the code as this is a bladder cancer patient. There's nothing in there. Did you mean to do like, the code is C67.9. That's what you send to insurance, right? They're like, hey, did you mean like B67.9? Like, did you mess up your alphabet? I'm like, no. Thank you for telling me that I have great news to give a patient, right? But it's the same thing. I have to inform them. So likewise, something that's come up a lot and it just came twice from two separate people. Ashwagandha has been getting a lot of, I guess we could say, like, publicity. It's always existed, but it's definitely gotten more popular. My only issue with it is that you got to tell me that you're on it, because some of my medications are filtered through your liver. Ashwagandha is filtered through your liver. Your liver and your kidneys, their job is to filter and clean your blood. So if I'm already giving your kidney and your liver a very important job of making sure that these chemotherapies, these immunotherapies are being filtered out of your blood accordingly, you got to tell me how many milligrams you're taking and how often you take it. Because what I don't want is to get your blood work back and suddenly you're in liver failure because your liver just pooped out. He was working way too hard. We can harmonize things. Sometimes I do have to tell you, like, hey, you cannot take that. I understand you might feel better. We got to find an alternative, because I can show you, like, these red numbers are not great. I always say you can't live without your liver. And so that doesn't mean that your medical team doesn't like that you're on a holistic measure. It just sometimes means that they are against what we're trying to do. And I promise you, the day that you tell me that all you have to do is drink a glass of orange juice every day and you won't get cancer, every doctor's office is going to have a free dispensing orange juice machine in the back. But until then, we have to harmonize holistic medicinal approaches with the conventional therapeutic measures. They have to go hand in hand. And I always say the beefier one, right? The immunotherapies, the cell therapy, the big ones that we do, they tend to have to take priority, because I can always go back and give you more of the holistic measure. Maybe we can, especially for side effects, very good for side effects. Hey, let's increase your what's that one that they were using recently? Black cohosh for prostate patients. Hey, let's get you back on that. That was helping with that urinary urgency that you were having. I don't have the ability to do that with chemo. I can't just say, hey, we're going to stop and maybe in 6 months we can come back. And we can't stop for multiple reasons. Number one, your cancer will be resistant if I do that. But it's also, from a money standpoint, I have to think about your financial well being. If I stop a treatment and then I want to restart it, I better have a damn good reason to give your insurance, because your insurance is going to be like, you said it stopped working. What are you doing? I'm not covering that. And mind you, I can justify it. Sometimes I can write it in like this is what we call like mercy care. Like, I'm doing this as a palliative measure. If I don't give them anything, they are going to be in so much pain. I got to do something, and they will approve it. But for the most part, I have to always show the logic between the transition between treatment 1 to treatment 2. I hope that was a bit roundabout, but I really hope that explained what your question was. I'm going to read it again. Yes. So yeah, that is the current interpretation and acceptance of something holistic coming into the picture. We are so here for it. There's even a certain MJ thing that we can't talk about because the TikTok gods will get upset. But there's a current push even to have more research in that field to see what capabilities can we help with that. We're open to everything. I always say it's the scientist that I got living back here that she's a little crazy, but
We will be
you put a subject
discussing
matter.
the MJ thing more next
Yeah,
Wednesday on integrative medicine, by the way,
exciting.
with Dr. Mike
Stay
Kuisner
tuned,
from Mount
folks.
Sinai. Just FYI. Go ahead. Thank you.
Yeah. No, I was gonna say, and that's why it deserves its own conversation. I've had patients ask me, like, um, is this something I can do? Is this something I should grow? Can I buy it? Does the Delta 9 stuff work the same? On all of those questions, I, as a scientist, because at the end of the day, I'm a biologist first, I hate saying I don't know because I can figure it out. But when we have restrictions, like it was for opioids, we can talk about those a little more openly. So any medication that's derived from the poppy plant, that red flower, is considered an opiate. So not all opiates are narcotics. Not all narcotics are opiates. So in order to be an opiate, it has to come from the poppy flower, that red flower with the black seeds. That's why when you eat a poppy seed bagel and then you go for a work drug test, you're gonna fail. Don't do that. But also, in the larger frame of that, it was avoided so long because all we saw were the extreme effects, the addiction, the way it could destroy you, the way it could maim parts of your body. And then it was some doctor that said, okay, but if I do only use a little bit, it's actually really nice. Like, can we get something in writing? Can we do a trial? Can we get it documented? And that's how that started. A lot of amazing medications were found and therefore developed because of happy accidents. My favorite being penicillin. Um, he wasn't, sorry, Fleming, he wasn't the best scientist. He wasn't very clean. He wasn't very thorough. He left petri dishes out and he shouldn't have done that. Some storm hit the lab. They couldn't get in for days. When he finally got in there, all his petri dishes were, of course, contaminated. But there was one that didn't have any bacterial growth whatsoever. He's like, okay, I know I touched this. Like, I know I did things to it. Like, what happened? Took a swab and he touched all the other ones that were also infected, left those for a day, came back, all of them were clean. But he's like, I know these weren't clean. These looked horrible yesterday. And that's how we found out what the fungal spore that is now used so often, penicillin, is. And that, it's, next time you get strep throat, look at what they're going to prescribe you, right? So it's the same approach with cancer. There's so much still unknown that we're just like, is it working for you? Amazing. Just tell me how much you're taking. Again, very long-winded on my part. Carissa, did you have any questions that came into you that you wanted to address? Because I just realized we're in the final 10 minutes of our little chat here.
I would like to, and I think we've touched on some of this, but I did mention to Tiff, one of the things I think that would be of big importance as a cancer patient, survivor,
Yeah.
and just a caretaker is what we call scanxiety. So that would be the lead up to I'm going to have my scan to see if my cancer has come back, and then the waiting for those test results. For me, for the last 4 years, I've had scans every 3 months. They do a CT scan of my body. So every 3 months, I'm having to deal with this. Just recently, I've now been able to move to every 6 months, but still. So yeah, I would love just Tiffany to if she could touch on like any kind of guidance she has or thoughts that have how to cope and deal with that, both as a patient survivor and a caretaker, somebody who has to deal with those of us that are freaking out.
I'm going to jump in real quick, Tiffany, before you do. For those of you wondering what Carissa's talking about when she said, like, I was doing these scans every 3 and now I'm going to every 6. This is what we call surveillance scans. We will take imaging of a patient during their active treatment. And depending on the severity of your tumor type, that can be as short as every month you're getting scans, all the way to every 6 months, but never longer than that. Because I need to justify that the treatment is working. I'm not going to keep you on something that's not working, even if it's for the sake of research. That would be completely unethical. The happy medium is about every 6 to 12 weeks is usually where you'll see these scans happening. They consist of, at a minimum, CT scans head to toe. Go on. And then once you're done with treatment.
And then now that I am no evidence of disease, so we're not in treatment anymore, I still, for the last 3 years, they check every 3 months just to make sure there are no signs of it coming back, even though I'm no longer in treatment. So even after you're out of treatment, this is something you continue to deal with for years.
I'm going to say the magic number is 5. So you enter what's called active surveillance. So no more port access, no more needles every day. But you go into active surveillance. And again, depending on the severity of how aggressive your cancer type is, for bladder cancer, when we start out, I'm over you. It's every 3 months. You and me are going to flirt. And I'm going to talk to you and I'm going to put you in a machine and we're going to get imaging. And then slowly we kind of think of like mama bear pushing the bird out of the nest. Like, okay, fine, you're in college now. Okay, you don't have a curfew anymore. And okay, now you have your first job. Okay, I won't call you every day. And slowly until we get to the magical 5-year mark. When you get to 5 years, again, if it's very aggressive, I'll only see you once a year for those images. But again, it almost is worse the more into surveillance you go. And you're like, okay, I'm getting to the finish line. But what if this is at 4 years and 5 months? This is it. So
I'm going to add a little piece of very interesting information I added just before we, move over to Tiffany to actually answer the question that was posed. So because I got cancer twice, what I learned was, yes, with the initial diagnosis, we're looking at that 5-year survival rate. As Kels was referring to that like, from your initial diagnosis, what is the chance that you will live 5 years? By the way, mine was 3.96% that I would live until March 2025. I am still here. However, what I have recently learned that is if you get re-diagnosed with a cancer, you're actually, after you go 4 years no evidence of disease after rediagnosis, you are very much less likely to get that same kind of cancer ever again. But it drastically increases your odds that you will get another type of cancer. So, just a little throw that one in the mix there for you, and I'll throw it back down to Tiff to talk about like coping skills and how we should what things we can do to help get us through this anxiety.
Yeah. Wow. Okay. It's been amazing talking with both of you. Like Carissa, thank you for your vulnerability and sharing your story. And Kels, you're like this like fountain of knowledge. And I'm just in awe of you both.
We're on all of you, Tiffany. Love
Catastrophic
you.
thinking. Oh, thank you. I think it's gonna come down and back to mindset because we've got to manage what's being thought. She's back. So like um this is fertile ground for catastrophic thinking, right? Before the scan, in between. And if we go back to what we're telling ourselves and the belief structure that matters, and there is scientific evidence that our cells hear us, our cells hear what we're thinking, what we're telling them. And so what we think matters because it becomes our belief system and that becomes our reality. And so intentional thinking. I always go to intentional gratitude. And when we're talking about gratitude, it's important to realize this is an and situation, not toxic positivity, right? Because if you're hearing me and going, yeah, I'm just going to be grateful when I'm in this situation, like I can see how that doesn't seem realistic. But when we're looking at it from the position of and, like, I can be grateful that I'm here to watch the sunrise today. And this sucks that I have to go get, chemo this afternoon. Or I am so glad that I got to see my children, grandchildren, loved one do this thing. And it stinks that I'm really nervous because in 1 month, I'm just waiting and just, waiting for the shoe to drop. And so we need to intentionally place our thoughts, even if it's when you hear your mind wandering, that you have a go-to sentence, because we don't want to come up with the tool in the moment of crisis. So you'll want to come up before with what you want to tell yourself, because in the moment when you're kind of cycling and worrying and having this anxiety, I didn't know about that terminology before. That is not the time to decide what you're going to tell yourself. So you come up with the thing before you make it simple and succinct, and repetition. But we've got to manage and control our thoughts, or they're going to control us. And that really is where the anxiety is going to either fester or so write it down in the morning. Like decide today, tell myself this. Today is going to be like this. Let's visualize. Let's use our breathing. It's really anxiety-ridden day. Before you step foot out of bed, lay in bed and play through your day, almost like on fast forward in the way you want it to go. This is a neurolinguistics programming technique, and I love this one. It's like you will visualize yourself walking as you are now, and then jump into this huge TV screen, theater screen, right? And once in the screen, now you get to dictate and write the outcome. And it makes it feel more real, because we're going to integrate into our feelings like as if this thing happened. And then our mind can also believe that, oh, we're not just full of it, because we can step out of the screen. So you step into the screen to give yourself that ease before you get out of bed, or whenever you need it. But if you can, on an extra hard day, set yourself up before your feet hit the ground. And so the other NLP is like visualize your current self full of fears, and then you have this ideal version of you back here, and you want to visualize the version of you. This is in your mind. You want to visualize the version of you that is suffering, struggling, and sick to becoming smaller and less vibrant in color, while at the same time, the version of you that is healthy and well and bright and full of life takes center stage. And then you want to stop. You want to open your eyes. And 3 times you want to do this. Switch. And it's very important that you open your eyes and break it and then come back to it, because these are ways we can rewire our brain. So those are 3 tangible ways.
I agree.
Love that. Thank you.
It really is half of it. I don't want to, but it definitely does show that the mental battle is part of it too. And I tell patients all the time, even when we're approaching the medicinal component, I don't care if the treatment is working, because if I put you in the hospital, right? I put you in the hospital, right? Suddenly you can't walk. Kind of ruins that image that you had of what a healthy you looks like. So that's not successful for me either. And it's probably the most difficult. But to sack the stuff in that bag hanging over your head was working isn't worth it. I always tell my patients, like, you told me you wanted to play with your first grandchild. How are you going to do that from an ICU bed? It's not always the easiest conversation to have, but when you're guiding yourself in whatever positive light you can, where you're like, okay, well, what I need is to get to this image that I have. I might not look the same. Like you said, I might have to delight in having a couple more wrinkles, my hair falling out of my head. But he wouldn't give a name. He kept saying Kashi the pirate is checking in for his appointment. And thank God one of the registration ladies recognized him and calls me, and she's like, one of your researchers is here. One of your research patients is here, and I think he's lost it. And I was like, we've all lost it, ma'am. So like, I'll be right there. And so I was like, like, hi, 8 p.m. on the Eastern Coast. It's only 5 p.m. for me right now.
With us
is it
while
5 p.m.?
you are
It is 5
business traveling, Kels.
Yeah.
But yes,
Although I got to be outside. California is gorgeous this time of year.
I forgot. Honestly, I was like,
But I wanted to thank
Kelsey
you all for
outside in
coming in.
Atlanta right now? I forgot you were in California. And that's all we'll say about that. But any wrap up thoughts
Yeah,
coming from
I did
anyone
want to
else?
say
We are
thank you to
also
everyone
having
that came.
connection issues, so that sounds great. Thank you guys. Thank you, ladies. Thank you all, loves, for being
You're
here.
so
We
such a wealth of
appreciate
knowledge.
you
That was
all.
amazing.
You can catch up with Tiff. Did we just glitch again? Okay,
See you
thank you
guys next
both.
week.
And
Totally
thank you,
catch you next
everyone.
week.
Yep, have a wonderful
Bye.
night. And
Bye,
we will
everyone.
see you guys again soon. Thank you, everyone, for being here. We love you. Bye.
Bye.